So today we are going to discuss about different OT positions. So we have different kinds of OT positions in which the patient is made to lie so that it is easier for the surgeon to operate on the specific body part of the patient. So we have different kinds of OT positions. First is supine position. It is a very common position for abdominal and breast surgeries because both abdomen and breast are on the ventral aspect of the body. So it becomes easier to operate on them. So the patient is made to lie straight on the bed, as you can see in this picture. This is called as supine position. Now next is Renderline position. What happens in Renderline? The foot end is raised. So it is at a higher level as compared to head, and it becomes very easy to operate on the pelvis in this position for the surgeon. So this is Renderline position for pelvic surgeries. Then comes next. This is reverse Renderline position. Reverse is just the opposite of Renderline. In Renderline, foot end was raised. Here the head end is raised, and so it is used in laparoscopic cholecystectomy. So what happens in this position is the bowel is pushed slightly downwards. So it becomes very easy to operate in cholecystectomy and all. So the surgeon prefers reverse Renderline position of the patient during these surgeries. Then comes next is lithotomy position. You must have seen this position during deliveries and during obstetric surgeries in your OTs. So this is used for obstetrics, gynecological, perineal and urological surgeries. But sometimes over-abduction in this position can damage the common peroneal nerve. So this is called as lithotomy position. Then comes next. This is lateral or kidney position. You can see in the picture the patient is lying to one side. So it becomes very easy to operate if you want to operate on one kidney, on the one side of the kidney or on one of the kidneys. So it is also called as lateral or kidney position and used for thoracotomy, pyelothotomy, nephrolithotomy and nephrectomy. Then comes next. This is sitting or Fowler's position. So what happens in sitting and Fowler's position? The head is at a higher level. So the blood it goes down. So a bloodless field is provided. So and better exposure will be there because the blood will go down in this position from the head end, and so bloodless field will help the patient to operate. So bloodless field and better exposure are the advantages, but it can lead to air embolism because when you cut the vein, that cut part of the vein will be exposed, so air might enter into that vein and so it will lead to air embolism. So it is used for cranial surgeries and breast reconstruction surgeries. This is sitting or Fowler's position. Then comes next, that is Rose position. What happens in Rose position is there is extension, neck extension or extension of cervico-occipital joint. So what happens here is you will place a towel roll below the shoulder blades with neck extension and the head is elevated by 30 degrees. So this is Rose position. Means what you will do is you will place a towel roll below the shoulders and the neck is extended. So there is extension of cervico-occipital joint. So this help in surgeries like tonsillectomy and adenoidectomy, tracheostomy. It is used when you need to operate on tonsils, on trachea, on adenoids, then it is used. But same disadvantage is air embolism because of bloodless field. When you cut a vein, air might enter and it will lead to air embolism. That is a very dangerous disadvantage. Okay. Then next is jackknife position. What happens in jackknife position is, you can see in this picture, lying in this position for a long time can lead to positional asphyxia. So that is why it is no longer used nowadays, but earlier it was used for hemorrhoids and fissure surgeries. This is jackknife position. Then next is Lloyd position. Lloyd position you can see is a combination of Renderline. What happens in Renderline? The leg end is raised. And what happens in lithotomy position? There is a slight abduction of the foot. So it is a combination of Renderline and lithotomy, and it is used for resection surgeries, abdominal perineal resection and low anterior resection surgeries. This is all about OT positions. Thank you.